think. Yes.
Okay.
Yes.
We're live.
All right, we're live. Let me just make sure this is refreshing. And sorry, everyone. Give us a minute. No, give me a minute to make sure I'm doing everything the right way. Thank you to my friend, Dr. Baldwin, for joining today. So, Dr. Nicole Baldwin is a very good friend of mine and has graciously agreed to join us today to do a live on all things pediatrics. And like I said in the comments, I think like maybe not all things pediatrics, but a lot of things pediatrics. And so I get asked questions like quite often that, you know, I don't do the day-to-day peds, so I don't know. And I'm totally fine saying I don't know. And so I was like, you know what, I'm gonna phone a friend. And
I'm the friend.
You're the friend. So thank you so much for joining us. And is it as cold there as it is here or has been here?
Well, how cold is it there? And then I'll answer that. I don't know how cold you are.
Well, the coldest we got in Baton Rouge was 21, which is like, I'm out. But today, I think the high was like 45, which was really exciting.
Yeah, we're a little colder than you. We were in the teens. I think today it was in the 20s. But we're used to that, right? That's how we roll in Ohio. We've got a lot of snow on the ground, but that's okay.
So, but y'all are snow, right? How often do you get ice?
Not a ton. We got a little bit of ice with this storm. It just depends. This is the most snow that we've had at once. I think I saw since like 2008, and maybe it was more than that. I don't know, because we got dumped on just like everybody else got dumped on multiple times. And so, you know, I've still probably got a good 8 inches at least on my deck that hasn't melted yet. You know, it's just, there's a lot out there.
8 inches.
Oh, for sure. But again, it's Ohio. Like, our roads are cleared. We didn't lose power. I mean, like, God love everybody in the South and Texas and everything who's, you know, your houses just aren't built for this, and ours are, you know. I mean, I've got water, I've got power. I'm very fortunate.
Yeah. And so, parts of Louisiana and, you know, so much of Texas has just been decimated by this winter storm, and no power, no water, and all of those things. And it's just been really sad. But at least some parts are getting power and water back. So
right.
For that, we're grateful. But okay, so Dr. Baldwin is a pediatrician in Ohio and is a very good friend of mine. And I can't tell you how I know her because it's a secret and we don't talk about Fight Club. I'm just kidding. But Dr. Baldwin, you don't talk about it. But if you're thinking like, ooh, Dr. Baldwin, and moms, dads, caregivers, cheers.
Happy Friday night, friends.
Happy Friday night. We've made it, at least until the kids go to bed. But Dr. Baldwin is, you know, a couple of days ago, I did a live with Russell Leday, who is a celebrity, and you are a celebrity as well. So Dr. Baldwin has been in, I Googled you earlier.
Forbes,
the Daily Mail, like,
New York Times. Yeah.
New York Times. I was like, oh my God. It's not even like gossip sites. It's like real. Okay. So Dr. Baldwin, inadvertently, or unwillingly, became famous last year because she posted this really amazing TikTok. It was super catchy. I still don't understand TikTok. and we've talked about this, where you were talking about vaccines and get this one and get this one, and vaccines don't cause autism, and you caught hell from the anti-vax community.
I did. Yeah. Like hell is an understatement. It was really bad.
Yeah. So and to the point that you had to have like a damage control team, which is, can you explain a little bit about that? It's like volunteer physicians.
Yeah. So, I mean, I didn't understand how big the anti-vaccine community was until they actually came after me. And I was like, whoa. But there's also an equally important and probably close to as big portion of people who are pro-vaccine that their main goal is to help people who are being attacked like me. And I didn't know they existed until they came out, and they were like the Avengers. They just like swooped in, and this group monitors basically social media, and when they see a post being attacked, they come in to help. And so I ended up on my Facebook page, I had 16 people monitoring my page 24 hours a day, 7 days a week for several weeks, because the attacks came in. I mean, people were coming from New Zealand and Australia and the UK, like comments were worldwide. And so fortunately, this group was worldwide too. And people would just volunteer and say, I'll take a couple hours, or, it's, whatever time here in Australia, I'll take a couple hours. And they were just blocking all the people coming after me. And it was just insane. I
certainly don't want to spend all of our time talking about this, because I need your brain on like
on Gen P
things. But I mean, just for like you guys watching, I'm not a good defender. Like I got that Cajun spice. Like I'm just coming in mad. But these people, like your defenders, your Avengers, are like, I mean, it's evidence. It's this article. It's this art. It's really, it's incredible. And I, like a few times, kind of stepped in and tried to say like something to, for you. And I got private Facebook messages like, I'm going to kill your family. I'm going to come after you, just for like
defending me
for my friend and for science.
Yeah. Yeah. And that is their tactic. I mean, that's what they do. And so many of these people are what you would call trolls, right? So they're just out to like attack whatever they don't agree with. And they will attack anyone. So if someone is defending that pro-vaccine person, then they'll come after you because they want you to shut up. They don't just want me to shut up. They want anybody else to shut up. And so it's just insane.
Well, and that, so on this group, on my PIM group, because Katrina, who is a friend of ours, right, helps me moderate this group, and we'll talk often because there are people of all beliefs in this group, which is fine, and I want us to have good conversations. But I feel like, being attacked is one thing. That's something totally different. But at least for the purposes of this group, I feel like if we can start a conversation with somebody, then, maybe we can get them to read and listen to a little bit of science. Right. So, but yeah, being attacked is next level. And
I think that's important to differentiate. There are people that are vaccine hesitant that have questions about vaccines, and that's not the group of people that I'm talking about. That's not the group of people that attacked me. Right. So there's that, they are the 1 to 2% that are very anti-vaccine and don't want anybody to get vaccines. And that's the group that kind of came after me. The people that have questions, I am more than happy to chat with them. As I've had many people that have DM'd me and asked me questions, and I'm so happy to have that conversation if that's what they want. When they come at me and they're like, spewing all of this research that is not fully scientific, I'm not going to waste my time with that. But
and so Dr. Baldwin, on her page, which I linked on the original, Dr. Baldwin gives a ton of, it's so logical, it's evidence-based, you've gone through it, and we we're the same, but we're totally different. We're both pediatricians, but we have different practices. And so that's part of your bread and butter, right? Is the immunizations. And my bread and butter is tetanus. I'm all over tetanus, and sometimes rabies. But
rabies, you got rabies?
Yeah, but not the day-to-day, and so that's why it's kind of one of the reasons I wanted to have you on. So for those of you watching, ask whatever questions you have. We kind of joked before that we have some topics in mind, but and one of the things that people had asked about for me to do a live on was vitamins, and I kind of told you that, and I was like, I don't really know about vitamins. I think Flintstones vitamins are okay, but and I forget to give my kids vitamins on a daily basis. So, what are your thoughts on vitamins?
Right. Well, here's the thing I will tell you. Don't worry about not giving your kids vitamins, because there is a very small subset of children that even need vitamins. Vitamins are, the vast majority of children over the age of 1 do not need a multivitamin every single day. Kids need to eat and get their vitamins and minerals from their foods, because a lot of times if you just give them a Flintstone once a day, they're peeing out half of that. Probably they're not absorbing it. And so, what I always tell parents, you want kids to do what we call eat the rainbow. And I tell that to my patients too. You want to eat the rainbow because different colors of foods have different vitamins and minerals in them. And I don't want parents to focus totally on it needs to be a rainbow of vegetables or fruits or whatever, just a rainbow. And yeah, we want fruits and vegetables, but we know kids eat fruits better than vegetables. So don't freak out. If your kid is eating, a rainbow of fruits, great. Still introduce and offer them vegetables, but don't panic if you're only getting a couple vegetables in them. Keep introducing it and it will get better. So yeah. And for parents who absolutely are no, I've got to give my kids a vitamin because I feel bad if I don't. I certainly don't recommend gummy vitamins. Gummy vitamins have a lot of sugar in them, and they get caught in the teeth and can cause cavities. So nix the gummies. And you really, do you have gummy vitamins? Yeah. Throw them away, Ashley.
Yeah, perfect, right? We're all flawed here. I'm learning too.
If you do give your kids a gummy vitamin, brush their teeth afterwards, because that gummy stuff gets stuck in their teeth and that can lead to cavities. So we don't like the gummy vitamins. I think the biggest, when I think of a vitamin supplement that I do sometimes recommend, a lot of it is calcium or vitamin D, because I think that's one of the things, especially in our older kids, our adolescents, kids, older adolescents that are in puberty, they need about 12 or 1300 milligrams of calcium a day. And that's hard to get because you're only getting 300 milligrams of calcium in a glass of milk. And let's be real, how many teenagers drink 3 or 4 glasses of milk a day? Not very many of them. And especially our athletes, we know that having adequate calcium and vitamin D helps prevent bone injuries. And so that is something, if I'm talking about a teenager, that is one of the few supplements I will recommend that they take. But otherwise, just a regular multivitamin. No, just feed your kids plants if you can. Those are what they need. Honestly.
One of Henry's favorite things to eat. So Jibby will eat anything. He'll try anything once. He's my adventurous eater, which is great. But Henry, I can open a can of green beans and just hand it to him, and he will eat the whole thing, and then he'll like drink the juice. I'm like, oh my, that's not good, but he'll like, drain that, but he'll just eat it. And Jack's like, don't we have to heat that? I'm like,
no, I don't know. They're cooked. Who cares?
It's good vegetables.
Well, and we used to give my daughter frozen, like the mixed vegetables. It was like the peas, the carrots, the corn, whatever. She liked to eat it frozen. And so she would sit there and we would have the frozen bag, dump it in. I mean, that's the thing. I think parents get stressed about like trying to cook all these really nutritious, whatever. And yeah, I want you cooking stuff. But if you have a bag of frozen vegetables, like, and your toddler wants to eat frozen peas, who cares? They're still peas.
So frozen vegetables are God's gift to us. Truly.
Yeah.
I mean, because who can chop vegetables? I'm not safe with a knife.
Well, I mean, I can chop them now that I only have a 16-year-old at home. But when I had little kids, no freaking way did I have time for that. You know, like I cook way better now that she's older than I did when she was a baby. But
and you know, we see so much in the ER. So we kind of talked about constipation and belly pain, and we can get to that. Yeah. But when we talk about that, we see so much of a focus on, and let's see, Lydia Green is watching. She says in Canada, she's in Canada.
Yeah.
Hey, I give my kids vitamin D, but it is recommended up here. And so I think I know why it's recommended up there. Do you want to talk about
Well, yeah, and I was going to add, Lydia, you're right. So vitamin D is another one, and vitamin D is a whole different ballgame, right? So especially in the northern hemispheres where there's not as much sunlight, because their main source of vitamin D is the sun, typically. And with putting sunscreen on kids so much, which we absolutely recommend to prevent skin cancer, that they don't absorb the vitamin D the same way. And there's vitamin D fortified in a lot of our foods, in our cereals, in our dairy products. But yeah, vitamin D. So for us, infants, breastfed infants, we recommend vitamin D supplementation for the first year of life until they're drinking cow's milk or having some other form of a supplemented vitamin D. They need 400 units a day. And so that is recommended. And again, with our older kids, if they're not consuming dairy, if they're not consuming, some of these fortified cereals and stuff like that, then vitamin D is certainly recommended, because you need vitamin D to help you absorb your calcium too. That's the other component of this. But yeah, in Canada, I mean, y'all probably don't get a whole lot of sunlight. So that will be part of
it. I think I remember that.
Yeah. And it's probably different for you, Ashley, because you're so far south. I don't know what you guys do for vitamin D down there, but.
Well, and it's interesting because we've seen, I've seen darker skinned children who don't go out very often, don't go outside very often, and only eat chicken nuggets come in with rickets. I mean, right? So, it's a huge, when we think about like all the things we have to do for our kids, and for that child, and this has been years ago, but for that child, that's like eating the rainbow. If she would have eaten the rainbow, probably could have, oh my God.
Which one of the children is that?
The furry ones, this one. And that mess, Lucy. I'm gonna close the door. Okay. I'm gonna lock her out. Okay. And then he gives Archie some like peace by himself because he's an old man. But yeah, so Lydia says it's recommended for everyone, every age, especially in winter. Yeah, I mean, you're inside, or if you're outside, you're totally bundled up. We see so much. I think sometimes I feel like parents get a little obsessed with milk, and and so not only like I won't even go through the they're 18 months old and they still have a bottle kind of thing, but it's such a focus on, and I think I don't know, as a parent, you get into this habit of like a bottle. Yeah. And it's hard when do we start foods? Oh, they don't like foods. Well, then I'm tired, so I'll try again in a week or a month, and then you lose track, right? And so then you have kids like Henry, who if I let him, he would drink his calories in milk every day. But now we've had to say,
you froze on me, Ashley.
Oh, can you hear me?
Are we good? You froze, and then I think we both froze.
Okay, I think we're good now. But you know what? The Wi-Fi in my house is terrible. So maybe I'll just shut down all of these windows. It's a lot of windows. But now we've started telling Henry, you can have your milk after you've eaten half of your food.
Yeah.
Right? Like, and so I think it's hard for parents to go from bottle to, oh, food, and then milk becomes less important. Do you see that as well?
Yeah. And I also think that it's very easy for parents to hand their child a cup of milk or a bottle of milk because they'll drink it and it doesn't make a mess. And so I see so often toddlers, especially, and parents come in and they say, well, they won't eat their dinner, they won't eat whatever. And I'm like, well, how much milk are you giving them? They're like, well, they won't eat, so I give them their cup of milk. I'm like, that's why they're not eating, because they know they're going to get their milk afterwards. And or the kids that walk around with a cup of milk all day long. And I will 100% admit that was my oldest. Like my oldest, he's 24 years old. I was not a pediatrician when I had him. I was a college student, and, he loved his milk. So he would keep his milk and he'd drink his cup, and then we'd fill it up and he'd drink it. Now, granted, he was also a good eater. He ate everything else too, but, that can lead to so many issues. Kids can have anemia if they drink too much milk, constipation, if we're going to go there. I mean, holy moly.
Next. Yeah.
And they just don't eat the rainbow because they're drinking so much milk. So, I really try to restrict kids to no more than 24 ounces of milk a day. I tell parents, have their cup with dinner with milk, or, with their meals with milk, but otherwise they shouldn't be walking around with a cup. And if they do, it should have water in it. And that tends to help. I mean, it's amazing how you don't give your kid a cup of milk and all of a sudden they'll eat their food. It's just nuts how that happens.
I mean, that's how we have to get him to eat his food.
Yeah.
And also with milk, and this is just for people watching, the sugar in milk is like your oral bacteria's favorite thing to feed on and grow. And so if you're giving your kid that bottle of milk and then laying them down, this is like, I was a psychotic mom. Like, they were little and they had like a half a tooth coming out, and they had their night bottle, and I was like, get some water in there. Get it out. And Jack's like, oh my God, you're a crazy person. But I think sometimes people don't realize that that's how you get the dental caries and the rotten teeth.
Yeah. Babies should never have a bottle in bed anyway. But definitely, if they have teeth, then you should be brushing those teeth after they've had their last bottle, which is so hard for parents. I know, because you're giving your baby that bottle and they're falling asleep with that bottle. And so you're like, how do I brush their teeth? I'm like, oh, and that gets into a whole other issue of teaching your kids how to sleep and all that stuff. And and Lydia's saying juice, like, don't even get me started on juice. Please, friends, do not give your kids juice ever, unless your pediatrician tells you to, because they're constipated. That's the only time I ever tell parents to give juice.
So let's talk for a minute about juice. And Lydia, thank you for bringing it up. And to everybody watching, like, throw out questions. We're happy to talk about it. So juice drives me crazy. Yeah. And the 100% juice, organic. No, it's like a bucket of sugar. This is terrible.
Yeah. I call juice the gateway drug. I tell parents, I'm like, juice is the gateway drug to soda and Gatorade and whatever else. I'm like, don't do it because it tastes good. Like our taste buds like sugar. And when the kids get used to that, of course, they're going to reject other stuff. I mean, you would too.
Yeah.
So, yeah. And again, I 100% admit, friends, my oldest was a juice kid. And here's the crazy thing. When people have old kids, like I'm not that old of a pediatrician, but because I have an old child, I've gone through different recommendations. When he was 4 months old, it was recommended that he have juice, that he have 4 to 6 ounces of juice every day. They had little glass bottles.
Well, I remember those.
Like Gerber had glass bottles that you would put a nipple on. And back in the day, and then you would give them the juice. And of course, he was this kid that absolutely loved juice. And every fruit snack and gusher and again, all of these things until thank God my husband one day was like, we're not buying this stuff anymore. And he's very healthy right now because he's, gotten older. But my youngest didn't have juice until she was 3 or 4 and started preschool, and they gave juice as their snack. And I had to fight with the teacher to give her water because she didn't want juice because she didn't like it because she'd never had it. Yeah. She had milk or water. And so, yeah.
You're right.
The juice, Jay.
The spectrum of the recommendations is it's
crazy.
Roller coaster. It's a roller coaster. So Holly Deluge says, I have this problem with my baby. He's 8. He's my only one that was like this, but I've always said he got used to drinking his meals when I breastfed him, that he rather drink than eat. And so Holly, I feel you. That would be my recommendation is you can have your milk after you eat half of your food. And sometimes it's me going 5 bites and he's like 4.5. I'm like, no, I said 5. You're gonna have 5. And so he knows that's the system and that's how he gets it. And then Mickey Bouquet was one of our peds residents. Hey Mickey, she said there's no point in juice, just give fruit. LOL. Yep. Yeah. And absolutely. Again, you said about the gushers, but the
fruit snacks, they're not fruit.
I won't call out the organic,
the fruit lovers,
fruit snacks. It's congealed sugar. There's nothing of nutritional value.
So and again, I don't want to come off as hypercritical because I think I do come off that way sometimes and I don't mean to. I think sometimes there are some convenience things that our kids maybe like. And so treat it as a dessert. If you're giving your child a thing of fruit snacks, in your mind, that should be you're giving your child a cupcake. So if you would give your child a cupcake at that moment, think of that fruit snack as a cupcake because everybody deserves to have sweets every now and then. I'm not saying that you don't. But don't treat it as here's your fruit or here's something healthy. It's I'm giving you a cupcake or I'm giving you a bowl of ice cream right now is what you need to look at it as. And then especially with again, with any of those gummy-ish things, brush their teeth after you do it.
Yeah, for sure.
Because all that sugar gets in there.
And Lydia says, if my kids don't eat much of their dinner, I'll offer them a PB&J an hour or so after supper. I mean, Henry's, I hate to keep talking about Henry because Jibby will eat literally anything, right? His favorite foods are sashimi and rack of lamb. So this is the problem with the kid that will eat anything. And then he picks 2 of the most expensive things that you could possibly eat.
Right.
But Henry's my vegan. And so, how do I get protein in him? Well, he likes avocado and he likes peanut butter. And so, Lydia, I do the same thing. I'm like, eat this peanut butter sandwich that's globs, so much peanut butter so that he'll just get some calories. But I would like to know as a parent, so this year with COVID and we won't even go there, right? We won't even go there, but he can't bring, because the kids are cohorted and eating in their classrooms, he can't bring any nut product. Well, the only thing I can get him to eat consistently is peanut butter. And so every day I'm ripping my hair out trying to figure out what to send him to school with because he won't eat what the school has.
Yeah.
Here, but he won't eat it. And so every day I'm struggling with what to send him to school with. Oh, and he hates chocolate, all chocolate.
You need to send him back. I don't know what is wrong with him. Can you get a refund? Like, seriously.
He calls his milk regular milk, like regular milk. And he calls chocolate milk dirty milk. Yeah. Yeah.
That's so funny. That's so
funny. He's 5. He'll be 6 in May. He's weighed 37 pounds for 2 years.
Oh my gosh.
So
what can you give him?
On the spot, but what can I put in his lunchbox?
Does he like cream cheese at all? Like, will he do like cream cheese on a bagel or anything like that?
I don't know. We might have to try that this weekend.
Does he eat guacamole if he likes avocados?
Oh no, boo! It has to be an avocado.
Okay, well then
we had to experiment with how to keep the avocado from turning brown.
Yeah,
if you cut it.
Yeah. I was gonna say, give him an avocado. What about like a cheese stick or something like that? Will he do those?
Yeah.
Yogurt.
He loves yogurt.
Will he do Greek yogurt?
I could send him with like 6 Chobanis and like the yogurts and the drinks, and he would just do that for you.
Right. But I mean, like, if you try to think of other that's so hard when, and I understand, and I'm very sensitive to kids who have food allergies, but it is hard when you have a kid that their main source of protein is nuts or nut butters, and you can't send them with that. Yeah. But, a lot of times then I'll tell parents, try cream cheese on a bagel, try a cheese stick, Greek yogurt. If he would do like avocados and, that'll give him those healthy fats and stuff like that. I try to avoid like protein bars and protein drinks and stuff like that because there's a lot of sugar in them. I guess, and the other thing, Ashley, is like, if all you have to do, like, if you can't get him a ton of protein at school, then just give him protein when he gets home. Yeah. You got to do what you got to do if you can't get it in at school.
So it's funny. Shelly says a bento type lunch with a bunch of little nutritious items. Yes. So that has worked for us. Like a bunch of little treats of different things. So my kids are probably the only weirdos at school with boiled eggs because they like boiled eggs. Yeah. The white. They don't want to eat the yolk. But Shelly, his favorite bento treat, he will eat a thing of strawberries. Like if I just put it in front of him, he'll eat the whole thing, right? But strawberries dipped in ketchup.
How did that even come about?
I don't know, but it's like a kid thing. Like it's not uncommon.
Well, yeah, no, my daughter used to dip green beans in ketchup, but not strawberries. Okay, whatever. If he eats them, he eats them.
Yeah. So we'll put him sliced strawberries with ketchup so he can do his thing. So bad. Okay, so let's talk about belly pain and constipation. And I'm gonna tell you what I get in the ER, and you tell me if this is similar what you get in. I get, and for those of you just joining us, please ask questions, type questions, whatever you got. Launch it at Dr. Baldwin. So I get the severe belly pain, doubled over in pain, like hit right away, doubled over in pain. When I hear that as an ER doctor, my number one is, oh, you're constipated and you have gas pains. It's number one every time, right? Doubled over in pain, belly hurts. And so then the first things I ask about pooping habits. Oh, they poop every day. That's always the answer, right? They poop every day. Yeah. Okay. What is the consistency? Because my kids we talk, right? Like you probably, like you and your kids, like we talk about poop a lot.
Sure. At the dinner table, right? Always.
Like Jack is gagging, your husband's gagging, right? And it was normal. Okay, well, what did you eat for supper last night? Well, supper last night is always like here is Cane's. I don't know if y'all have Cane's.
Yes, we do.
Okay, so that's based out of Baton Rouge. Next time you come, did y'all go look at his treehouse when you were here? I can't remember.
No, I don't think
Todd
so.
Graves, the owner, sidebar while we chat. Todd Graves, the owner, was on Treehouse. Somebody help me.
Treehouse Masters.
Thank you.
Yeah.
And he built a huge treehouse, and so we can drive by his house and see his amazing treehouse. But
okay.
He is the founder of Cane's, and so it's uncanny when I say, "What did you have for supper last night?" They'll say, "Oh, I had Cane's." And then especially for the teenagers, well, what did you have today? Because like if they're presenting in the afternoon, oh, well, I didn't eat breakfast. I didn't eat lunch, because teenagers don't eat breakfast. They don't like the lunch at school. And so then they're coming home and like eating everything and eating probably not the most healthy things until bed. And then I get that X-ray and I show it to the family, and it's just this look of horror. Like, how is this possible?
Yeah. Yeah. Well, and I think the key point that you said there is, you can still be constipated, or your child can still be constipated even if they poop every day. Yes. So that is one of the biggest misconceptions, because kids can have these little tiny pellety poops and still be constipated. They can even have loose poop and be constipated, because there is something called encopresis, which is this great big medical word that we all like to talk about. But that is where you basically have an impaction of stool in your rectum, and then the softer poop like leaks around it. And so some parents will be like, no, they have like loose stools or they have diarrhea. But it's not, but that's because they've got this big old mass of poop that has to come out, and it hasn't come out. So yeah.
You bring up a great point. And well, Shelly says, stool charts are my best friend. Awesome.
Crystal stool chart. Look it up, friends. Google it.
Yeah. Stool chart. It's eye-opening, because you think like it's normal. It might be your kid's normal, but it's not actually normal, right? And so Lydia says, tips for withholding. My 2-year-old is doing this now, and it drives me crazy. And so, but I think that's important to talk about for school age kids too, because some school age kids won't poop at school.
Right.
So then they hold it, and then it's that vicious cycle.
Right. Right. And that's like, withholding is one of the things that like you've got to address early on, because if you don't, then they end up having encopresis, because if they're holding poop in, and oftentimes it happens because they've had a painful poop, they had a constipated poop, and then they hold it because it hurts and they don't want to poop. But then what happens is they get more and more poop in there. And guess what? When they poop again, it hurts. They hold it and their rectum gets stretched. And I will tell parents a lot of times, if you think about moms, when you had a baby and your uterus got all stretched out and floppy, and your abdomen got stretched out and floppy, and it doesn't work as well. The same thing happens with your colon and your rectum. If it gets stretched out, then it gets kind of floppy when that poop comes out, and it doesn't work as well. And so it's more likely to get, continue with this cycle. So there are certainly, so beyond just like eating fruits and vegetables, fiber, and this is the time when I will tell parents sometimes, if you have to do a fiber supplement, like a fiber gummy, but brush their teeth after you do the gummy portion of it. Water, lots of water, watch the dairy. Cheese is very constipating. Milk, and a lot of kids, is very constipating. So watch those dairy products. And then if that's not helping, you need to talk to your pediatrician about, there are stool softeners that we recommend for people. Again, we're not giving medical advice here totally, but there are stool softeners that are very safe to use, that can be used for long periods of time if they need to. And, I have parents sometimes that get nervous about giving their kids those medicines, but I promise you, if you treat it early and treat it well, then you won't have this issue down the road. If you wait and drag your feet, it's going to take a whole lot longer to treat it, and it's going to be a lot harder to do it. So that's kind of my constipation in 2 minutes or less.
Yeah, no, I mean, I think it's it's such an important thing to talk about because I think we're busy, right? Parents get busy, and then you don't realize how much of a problem it can be for your child. And Lisa, crochet, that's how I think we would say it in Louisiana, but you would maybe say crotchet. But
I would say crochet. I'm not
You
a
would say crochet.
hick. What are you talking about?
I don't know. You're
What are
from
you
Ohio.
calling me? Hick from Ohio.
I'm kidding. Okay. My daughter had constipation issues. Poor thing would cramp so bad and then have panic attacks from the pain. She learned early on what foods helped and how long she can go without pooping before she's in trouble. I've had the school nurses work with her. This is fantastic. Like, Lisa, that's really amazing. And for the boys, they still tell me, oh, Lisa says perfect crochet.
Yeah.
The boys still say, Mom, I had the hard poops. And then they know, like, if I need a quick fix, I'll give them those, the Trader Joe's little fruit squeezy packs, like do a couple of those and then it makes things soft and things come out. And
we always say the pea fruit. So like pears, prunes, peaches, like those are things that tend to help move it along. And again, like I said, this is the only time I recommend juice. And I usually recommend prune juice because prune juice is kind of gross, but like prune juice, apple juice, those kind of things can help with the, softening up the poops.
If your kid is having problems with pooping, Shelly says, I'm a school nurse and have the stool chart taped in the office bathroom. It helps with the hesitant poopers because they get excited to tell me what poop number they are.
I love that. That's hilarious. That's genius.
Shelly, that's genius.
I'm going to tell every school nurse to pop up a Bristol stool chart in the bathroom. That is perfect.
So Lydia's asking about Miralax. I mean, we often recommend Miralax. That's one of our go-tos. Chelsea says, my daughter has been easily constipated since she has had anything but breast milk, which is not an uncommon problem, right? Because it's a change to the gut. Her pediatrician had me put a tablespoon of Miralax in her milk. We still do this at 3. Anytime I've tried to stop it, she gets constipated and is afraid to poop. Is it okay for her to have the Miralax every day? Is that something that would be recommended? I think I would ask, like, what else is in her diet? And milk, if she's 3, then kind of what we were talking about earlier, like how much milk is she having?
And how many other like high fiber foods and things like that. Because I think the other thing that can be deceiving, I think a lot of times as parents and even as physicians, when we think fiber, we think, oh, fruits and vegetables. But really, it's a lot of whole grains, like oats and whole wheat bread and things like that, beans. And so, I have kids that come in that are great fruit and veggie eaters and are still constipated because it's other things that have more insoluble fiber in it that really help them go. And I would probably say for Chelsea that, if you have a kiddo that for 3 years has needed Miralax every day, it's probably a good idea to discuss that with your pediatrician and maybe consider seeing a GI doctor just to make sure there's not something else going on. So there are rare instances where kids can have other issues. There's something called Hirschsprung's disease. There's other things that can cause pooping issues. And we would just want to make sure that there's not anything underlying. Now, granted, can kids be on Miralax for that long? Absolutely. And, not to open a complete can of worms, but there are some hypermobility syndromes where kids' collagen doesn't hold together very well, and those kids are constipated a lot. I mean, I've diagnosed hypermobility syndromes, EDS, in kids simply because they've come to me for constipation, and I've been like, let me check your flexibility. I'm like, oh, look. So that can be a presenting sign sometimes. You can't diagnose it at the age of 3, but just in the back of your head, parents, if you have a kid that's constipated for long years and years and years, there might be another reason. So
I'm just impressed that I figure you're talking about Ehlers-Danlos. You said EDS, and I was like, wait, what? And then it clicked.
Sorry, that's a primary care thing. You probably don't get much of that in the ED.
Like after diagnosis, right? Like
right. You'll get the kids that pass out from their pots.
I'm not diagnosing this. And for those of you watching, just in case you're wondering, I didn't know about this halo light business. So Nicole looks lovely and like she has color, and I look like a vampire. Like gray.
It's all right. Okay. Maybe get yourself a ring light. Ashley, I'll send you a link to my ring light from Amazon. It's all good.
I'm going to get a ring light. Can we just talk for a second? And actually Jenno and I were talking about this the other day, who's another friend of ours who's a pediatrician and is amazing. So I bring my kids to well visits every year. But I didn't realize until talking to her that a lot of people don't bring their kids to well visits every year. Mm-hmm. And then as I started thinking about the ER, when we'll ask, you know, are they healthy? Any medical problems? Oh, well, we never go to our doctor because they're so healthy. And I always think like, how do you know they're so healthy if they never go to their doctor, right?
Right.
But so how important is it to have a well visit every year, even if everything's perfect?
Yeah, I mean, I think it's super important. Of course I do. That's my bread and butter, right? But so at a well visit, beyond just the visits where we give vaccines, which are actually a small portion of, you know, our overall visits, we're doing things like monitoring their growth and making sure that from a growth standpoint, from an early puberty standpoint, all of that kind of stuff, they're following along as they should be. We are doing a lot of what we call anticipatory guidance. So we're talking about behaviors, we're talking about school, we're talking about bullies, we're talking about seatbelts and bike helmets and gun safety and, you know, all of these kind of things that are important. And I think a lot of times we are raising questions that parents didn't even think that needed to be raised. And that opens up that conversation for parents to talk to their kids about certain things. And so I think, you know, in my mind, like I still take my daughter and I took my son every year, and I'm a pediatrician. Like I can do that anticipatory guidance at home, but I still take them because I know how important it is. So even if they're not due for vaccines, it's still super important that you take your kids every year. And it's even now, like one thing I'll plug, I know we don't want to talk about COVID, but in the era of COVID, I can tell you that as pediatricians, like we have done so much, we have changed so much in our office practices this year to make sure that we're staying safe and that we're keeping our staff safe and our patients safe. And especially now, like that we've been able to get the vaccine, most of us, our offices are even safer because our staff is vaccinated. But you know, it's so important. Please don't be afraid to take your child into the pediatrician, and especially if your child is due for vaccines, because we have noticed a drop in vaccinations over the past year. And so what that could lead to is an outbreak of something like measles, or, you know, mumps or pertussis. You know, we've got enough on our plate with COVID right now. The last thing we need is to have kids hospitalized with measles and, you know, all pertussis, things like that, because those illnesses can actually be more harmful to kids than COVID can. So we want to make sure we keep those vaccination rates up. So yes, please bring your kids in.
Yeah, 100%. And so your people will say that on here all the time, like, or say it in the ER. I didn't want to come because I didn't know how safe it was to come. Mm-hmm. You know, it's safer coming to the ER or going to your pediatrician than it is having a family gathering, right?
Yeah,
like,
yeah.
Just the reality of how things are now.
I want to ask Lydia a question. So Lydia, were you afraid that they were going to force you to vaccinate? So Lydia, I'm going to admit, I know Lydia, but Lydia used to be anti-vaccine and then changed her, you know, did research and changed her mind and is now very pro-vaccine and actually speaks out about the anti-vaccine community. And she's there to support parents who are questioning vaccines and whatever. But I know that one of the reasons that she kind of doubted vaccines was because she didn't feel heard when her child had a reaction to a vaccine. So what she said, that when she was anti-vax, she didn't take her kids in every year. She was afraid. So I'm curious if she's still on here, what she was afraid of, if it was afraid of being forced to vaccinate or what she was afraid of. So I don't know.
Yeah, I mean, I think that's we often can get quite defensive. And instead of just stopping and taking a breath, and now when I have parents say, well, I don't want this, whatever it might be, right? Instead of saying, you know, your child has to have it, I say, talk to me about your hesitations.
Mm-hmm. Right.
Right.
What
like,
questions
just
do you have? Yeah.
explain your hesitations.
Mm-hmm.
But that's not the easier route, because when you do that, right, you invite, like, oh, this might take 20 more minutes, right? And especially in primary care, like, you have a finite amount of time
Mm-hmm.
to be able to address a lot of
Mm-hmm.
concerns.
Mm-hmm. Yeah. But that's what we do. Like, I would encourage people that if you feel like you have a doctor or a pediatrician that's not listening to you or your concerns, maybe look for a different pediatrician. Because again, you're right. We have a finite amount of time, but I will take that time. And if I feel like I need more time, I'll say, hey, let's make another visit to discuss this. But I do my best, and I'm not perfect. Nobody's perfect, but I definitely think everybody has a right to ask me a question. And if I don't know the answer, I'll try to figure it out. And, I just think that that's what makes people a good doctor, right? So, I don't know.
And you hit the nail on the head, her answer. And I think that's a flaw, we're so defensive.
Mm-hmm.
You need to have vaccines. Mm-hmm. And do you want your kid to die? Like, that's a horrible thing to say.
Yeah.
I'm sorry, Lydia, that anybody ever said that to you.
Yeah. It's hard. And I think too, we are not necessarily educated on how to best communicate with vaccine hesitant parents when we're residents or when we're in medical school. We just aren't. We're too busy learning about these random, like, amino acid disorders that we'll never see in our entire life. I mean, I had an amazing pediatric residency and an amazing experience, but I think that some of us we're all learning on the fly in the beginning, and everybody has to, it's hard. It's a hard conversation to have. And some of us aren't confident in our answers all the time either. We're not perfect. We don't know everything. And so, yeah, that's hard, Lydia. I'm sorry.
You kind of alluded to, say, I'm in school to become a public health nurse now. That's amazing. Yeah. That's amazing, right? Like, you took that, and that's pretty incredible.
Yeah.
You said about, we could do a whole separate live on raising kids now in this age of social media and bullying and all of those things, and that it doesn't just happen to kids, right? I mean, you were bullied, I've been bullied, right? But I think this is why it's so important to have your annual visit with your doctor, because there may be things your child doesn't feel comfortable disclosing to a parent. They will talk to you about, right?
Right.
Yeah. And I think kids, and we hear this a lot in kids, is, well, I didn't want my mom to worry. And I think like, it's our job. Like, that's what we do. That's like the only thing we do most of the time, right? Is just worry about our kids. So have you felt that, like, kids will open up to you more than
absolutely. Yeah. And I think especially now, I'm seeing a lot more kids with depression and some anxiety, given everything that's going on with the pandemic. And I hear that a lot. Mom or dad will step out of the room, and then the child will just, start crying and say, you know, I don't want to worry them, but this is how I've been feeling, because kids are sensing our stress too. And we're all stressed, right? I mean, come on. Everybody is stressed right now. We've been in the middle of this for over a year now. We're stressed. Our kids are sensing that. And so then they're stressed, but they don't want to add more stress to us. I mean, it just is this big vicious cycle that, yeah, so bringing them in to see us, and we screen all of our adolescents, we screen them for depression. And so we will find kids who screen positive that parents had no idea, because these kids were keeping it all inside. Mm-hmm. And so again, if they hadn't brought their kid to that visit, they never would have known how they were really feeling, and then had that opportunity to talk to their kids and let their kids know, like, hey, I'm here for you no matter what. And so I think that it's beyond valuable to bring your kids in every year, because there's so many things that come out. Yeah, become uncovered.
And you know, like I think in school, and this is just for what it's worth, for whatever parent needs to hear this, you know, if you have a problem with your kid in school, sometimes schools, they're used to seeing, like, you know, they've done this for 20, 30 years. And so it's like another kid. And so they approach and how they address parents with specific issues may not be super personal. And it feels like it's just your kid, or you failed as a parent. Right. And I equate it to, like I tell my residents, the way you treat fever. I mean, I've seen, I don't even know how many thousands of kids have you seen with fever, right? And you're like, whatever.
Yeah.
But in that moment, for that parent, it is the most concerning thing. And so you treat that parent, you treat that kid like it's your own kid, you know, and you will address it with compassion. And I don't know if it's because the schools are stressed as well, but the way it's relayed to parents isn't super compassionate. And so parents feel like it's only their kid that's having an issue, or it's something that they did wrong, when really what I'm seeing, and I don't know if you're seeing, is that I don't know how many teenagers now, I don't know how many are not depressed or haven't had some of those feelings, right? I think it's more common than not, at least. Yeah.
But nobody talks about it. And so I think that, and even kids, they feel like there's something wrong with them. They feel like nobody will understand. And, you know, what I always try to tell kids is that obviously I can't give specifics, because that would be a violation of certain rules that I have to follow. But, you know, I can say, you're not alone in this, my friend. There are a lot of kids that, you know, are in counseling or take medication for these types of things. And so I hope, and I do think, so there are a few benefits to social media. I will say it goes back and forth, but I do think that, you know, having groups that can discuss mental health and kind of get that out so that kids can understand that they're not alone is great. We have to balance that with, like, there's some bad stuff about that too. But knowing that they're not alone, being able to reach out when they're isolated at home, because I think that's where I'm seeing a lot of these kids that haven't been in school, that are, you know, isolated, that they're stuck on a computer all day long. They're only with their parents, and maybe that parental relationship is not totally healthy.
Yeah.
And so they don't have the ability to be around their friends and to be around their teachers that were their support before all of this. And that's just exacerbated everything this year. So that's another reason we need to get our kids back in school. Don't get me started on that.
It is, it's balancing physical well-being, right? Like COVID physical well-being with mental well-being, because We've seen those kids that stay, their parents are so worried because maybe there's a family member that's elderly in the home or a family member with cancer, whatever it may be. And so they choose to have their child virtual and there's no outside activities. And then you do have to consider that kid's mental well-being.
Right.
Lisa said anxiety versus normal nerves. Any tips to help teens work through these feelings? I feel like the anxiety and normal nerves, it
is. And it's a continuum, right? Because it starts off kind of more as normal nerves. It starts off as being nervous about that test or about a change or about whatever. And then when it really kind of snowballs and becomes about more than just that event and becomes about other things, it starts creating, systemic symptoms like stomach aches, like headaches, like nausea. It starts to interfere with their daily activities. They don't want to do something because they're feeling anxious about it. So it starts like slow. And what I always tell parents in terms of both anxiety and depression, the sooner you can get help, the sooner you can get your child talking to somebody, doing, some mindfulness activities. I will say, I'm a huge proponent of meditation and mindfulness, and there are studies upon studies out there about helping with anxiety and depression. So get your kid on an app for meditation, 10 minutes every day. I promise it will change their life. It changed my life for sure. So what I tell parents is it's a whole lot easier to step out of a 2-foot hole than to crawl out of a 6-foot hole, right?
Ooh,
so with anxiety or depression, kids don't wake up one day and all of a sudden they're like, boom, I've got generalized anxiety, or boom, I'm, depressed and having suicidal thoughts. It's a slow process. And so it's important that we try to intervene earlier. And what I find happens a lot is parents don't call me until they're in crisis. Parents they're like, we've been dealing with this for a year and now all of a sudden I can't get, they're having panic attacks and I can't get them out of bed. And they get frustrated and upset when I can't see them for 4 to 6 weeks because I don't have an appointment slot or whatever. And that breaks my heart too, because I want to see them. But what I really want to educate parents is that if you can intervene sooner, if you can kind of get that help when they're just kind of, they're exhibiting those signs that are more consistent, that you're seeing them, more than once or twice a week, that they're having consistent nerves about certain things, or they're staying in their room more and they're more sad or withdrawn. You need to catch that early. And don't be afraid to ask your pediatrician, ask your school counselors. There's the resources, unfortunately, for mental health aren't always the best, but they are there. And I think it's important that you reach out sooner rather than later for a lot of those kids.
Yeah. 100%. And, we unfortunately see the teenagers who, a lot of these kids had, the signs were there along the way, right? Like the temper tantrums that were left unchecked and those kind of things. And so then they become big teenagers that the family can't physically control, and it gets to be a huge problem. And so that's where we run in, like I need a fix right now.
Right.
And it's just, unfortunately, it's just not the way, it's not the way it works. So I'm going to read a few of these comments. Lydia, you're my favorite. She says, my teen has a flip phone. Love it. She actually doesn't want a smartphone because her friends get bullied in social media. Yeah.
As long as you can keep your kids off of social media, do it. Like, seriously.
Yeah. And then she said
TikTok. I know they all have TikTok, but
I still don't understand Snapchat. Like, how can I understand TikTok? I don't like.
I don't do Snapchat either. And like my daughter, she just like takes pictures of the ceiling, and then like I feel like it's like glorified texting. I don't even know. Whatever.
Lydia says my daughter has very positive interactions playing Minecraft with 2 friends. I love to hear them giggle, and I get to monitor the interaction. So my boys are obsessed with Minecraft, but they only do the creative Minecraft. Like, they don't play with others. And that's mostly because I don't understand how to set it up. But I want to do that at some point. I want to do that for them because they build stuff and I'm like, wow. Like, wow. That's amazing.
Yeah.
Henry built me 2 houses in his Minecraft world, a big one and a small one.
Oh.
Like, okay. Chelsea said, as a middle school teacher, I've definitely noticed these challenges this year. The depression, the anxiety, the delay in social development. Our kids have missed almost an entire year of development, not even addressing curriculum. And as far as schools, so much more is being asked of them. I think it's so easy for us to forget that. So thanks for this. Yeah, I mean, we as adults suffer from pandemic fatigue. And so I think we forget to give our kids the grace of, like, this is a whole new thing for them as well.
Yeah. And middle school, God love you, Chelsea. I mean, middle school is tough anyways. I mean, 5th through like 8th or 9th grade is just so hard, even when we're not living in the middle of a pandemic. So yeah, I think the more you can give your kids some grace, the more you can kind of try to arrange, if there's a way to allow interactions with friends that can be done in a safe way, whether that is, through Zoom, whether that is if you have lower rates in your area and you don't have a high risk person, if you can get them outside in masks, socially distanced. I remember, like, the best thing we did for my daughter was when, sometime in the summer, I think. She's a gymnast and her gymnastics got shut down March 13th. Like, we remember the day. Like, a year ago, we were in Baton Rouge. I saw Ashley in Baton Rouge for a gymnastics meet, and we did not know that would be our last gymnastics meet for nearly a year. And so when you have a kid that's 20 hours a week in a gym with her friends, and then it totally gets shut down, and her school got shut down, and she was over her 16th birthday, like, it got shut down 3-4 days before her 16th birthday, all of that stuff. And so then several months out, our numbers weren't super high here, and we surprised her and got her friends, 4 or 5 of them together in a parking lot at my office, where we all sat like apart, 6 feet apart outside. And I mean, to see the smile on her face, and to her mood immediately shifted. And again, this was a different time. This was not right now when numbers are high and it's cold outside. But if there's a way you can kind of get your teens especially to have some interaction with their friends in a safe way, it will help them so much.
Yeah, and I feel like now that we know, so Nicole and I are both big Hamilton fans. Like, we know what we know. How's that line go? Like, but
the people don't know what we know, or people won't know what we know. Yeah.
Pamphlet.
Yeah.
Like, so before the Reynolds pamphlet.
Yeah.
But now we know that masking is super effective. And so, like Lydia says, my daughter lost jujitsu. She loved it. Mm-hmm. I mean, I feel like we know what we know. We know masking works. I mean, if people can just be cooperative with the masking, then let's do jujitsu. Gymnastics is a little bit harder, right? Mm-hmm. You're flipping, and if the mask comes up, like, that could be
but they've been back and they've been fine. It's interesting, how they can distance and they can do it and they can wear masks. I think that's the other thing we forget is, like, kids can wear a mask and run up and down a basketball court. They really can. Like, yeah, they can.
Yeah. Henry, so my boys are K and second. The mask requirement for their school is 3rd and higher, but they wear a mask. Yeah, they wear a mask every day, all day, every day. And like, bribery goes a pretty long way. Yeah. I've gotten, like, the teacher says, oh yeah, they're wearing masks. Like, they get special treats.
So are there some kids that aren't wearing masks then? Okay. Because in Ohio, it's K and over. Like everyone, like kindergarten and over, they all have to wear masks. And some of the kids in preschools, it depends on the preschool. Some of the preschools are wearing masks. And that's the thing. So there's a huge debate right now about getting kids back in school, right? Because different parts of the country haven't had kids in school and people are like all up in a tizzy on Twitter about it. I feel like I've gotten in a couple Twitter wars lately because we've been in school since August. Like Ohio has been back in school. And our governor even did a study with several schools in the state, I think 2 or 3 of which are in my area, where they did contact tracing and looked at transmission and whether or not transmission was higher in the schools, in a school setting versus out. And they found that there was no difference. And actually there was more likely transmission, obviously outside of school than inside of school with these kids that were masked. And they have to be distanced at least 3 feet. They don't have to be 6 feet in our schools because of the way the schools are. But there is one district here, our big main public school district, that hasn't totally gone back yet. Some of the schools have gone back hybrid, but all the other public school districts and the private schools have been back since August, and we haven't seen a ton of in-school transmission. So it can be done safely. We just have to do it right.
Yeah. What are your thoughts on, so this is a hot topic. I realize you might want to pour a little bit more wine.
I was going to say, I might need to get my husband to fill my glass.
Yeah, do. And tell him I said hello. What is your thought? There's the CDC defined close contact. But I don't know, like some schools, I don't know if you're counting recess, right? Because they're not masked at recess. And like the school may say they are, but like, kids are really honest. When they get in car accidents and the family's like, they were wearing their seatbelt, and you go and ask the kid and they're like, no, it wasn't.
Yeah.
They're just brutally honest.
Yeah.
So you have kids at recess that are not masked and they're super close together. And so are those counted in the close contacts, or is it just the kids that are sitting next to them in class? And I think that's what some of us have struggled with. Not because I would keep my kids home and say, well, I'm going to quarantine them, but I would make some educated decisions about, we're not going to be around my parents for the next
several
10 days.
Yeah.
So what are your thoughts with notifying, not necessarily the whole school, but like a class, if there's a positive in the class?
Well, and I think that they need to be notified, and that's what we're doing. I mean, in our schools, they're notified. It's just they're not necessarily told to quarantine if they were masked at the time. If they were not masked, so if it was a kid that was sitting at the lunch table and they're there for 15 minutes and they're unmasked and they're eating, that's a whole different ball game. The other thing I think that is important, and this is so nuanced and so hard, and we're trying to figure it out, but when your kids are playing at recess, how often are they really within 6 feet for 15 minutes at a time? Like they're running around, they're playing kickball, they're maybe back and forth on a swing, and they're outside, so it's like you need to notify and you need to be cautious, just like you said, but we also need to understand too, not to freak out ourselves, because they're probably not going to get it, but we need to be safe. We need to be careful. It's that like balance. It's that, like you said, you're not going to see your parents for, however long, but if there's nobody high risk in your house, maybe you're not going to like panic and shove them in the basement for 2 weeks, right? But if your kid was on if your kid had a sleepover and somebody was positive, then which don't get me started on that. But if your kid had a sleepover and somebody was positive, then you need to be wearing masks in the house. They need to be like isolated. You need to take those precautions because the risk of transmission is very different depending on, your exposure.
Right. The contact. Right. Yeah. Right.
Yeah.
Okay. So I have taken too much of your time for this live, but I want to chat with you. I haven't talked to you in forever.
I know.
Nicole and I, just a fun story. Nicole, was that 2 years ago that you were taking Kendall to Chicago to see?
That was like 3 or 4. Like, I want to say that was like 2017, maybe 2018. It was a long time ago. I need to look at my photos and see what.
Nicole was like, I'm taking Kendall to Chicago to see Hamilton, and I said, well, I want to go. I'm coming, and called a friend who used to live in Chicago, and we went, and so Nicole and I got to hang out then, and we saw Hamilton, and it was
awesome,
amazing, and then we did, and then Kendall came for gymnastics last year, and it was the weekend before the state shut down.
Mm-hmm.
And it was right after Nicole's celebrity, I think it was, I mean, I'm not in your shoes. I think you were such a voice for us, for pediatricians, but I know it was such a sacrifice for you, and it really was incredibly hard. But I remember being so proud. Like, I saw you, so proud, and I was so excited. And then, like, life shut down right after that.
Yes, yeah.
For those of you in Louisiana, Kendall loves LSU, and she's thinking about LSU. And so, if you want to send her any swag, I have Nicole's address.
She does have some LSU gymnastics swag already, but yeah, when we were down there, but she did. It's a gorgeous, gorgeous campus for sure.
Oh, and it was a beautiful weekend. Like, the weather was
beautiful. It was so nice.
Beautiful.
It was so nice.
Okay.
But no, it was 2017, Ashley. I just looked at the photos. It was 2017. So it's almost been 4 years ago in Chicago.
That was 2 years.
Time flies when you're having fun.
Oh my God.
Yeah.
That's bananas. Okay. Few questions to leave with. Number one, I work a lot and have a hard time keeping track of the clothes situations, right? Like, Jimmy puts pants on and he's like, Mom, and the pants are like midway up his leg, and then they put they put shoes on, and Mom, these are tight, and the sad statement comes out, like, how tight are they? Like, so what? Like, give me tips on staying on top of getting bigger sizes for my kids. Do you have tips for this?
I've never had this question come up ever in 14 years of practice.
Like, I feel like I need an Amazon alarm.
Like an alert. Like, you need that, like, how they, like, for me, they automatically send me my razors every, like, 6 months. You just needed to automatically send you bigger shoes.
Bigger shoes.
Right?
Longer pants. Like, yes.
Well, I mean, if you think about it, like, your kids are growing, a couple inches every year. So you can anticipate that they're probably each season, when they need pants, they're going to need longer pants the next year, probably.
But it's never, it's always like you realize it when they need it.
Right.
I mean,
but you know what? Your kids can wear capris for a day or two. They can wear, like, tight shoes for, just, I don't have a great answer for that.
Words. How tight are they? Can you make it the day?
Can you wear, well, that's when they just wear sandals, right? Can you just put them in sandals? You live in Baton Rouge. It's warm enough.
I don't think the school would let us, but like, if we get a note home, we get a note home, right?
Yeah, you'd be like, it's fine. It's all good.
It's fine. Okay, my other question is, what is your favorite kids book? Like, book for kids? Okay, wait. I'll two-part this.
Okay.
Your favorite book that you read to your kids, and then maybe there's a favorite book now.
So I would have to say each of my children have a different favorite book because they like different books. So probably the book for my son would have been The Cat in the Hat, because he always wanted that book read to him. I thought he was a genius when he could recite the entire book.
He memorized it.
When he was like 3, and I was like, oh my God, he can read. And I'm like, no, he just knows the words.
Yeah,
Like,
he memorized
I had it memorized because we read it every day, you know.
Yeah.
The sun did not shine. It was too wet to play. So we sat in the house all that cold, wet day. I mean, I seriously still,
You got it.
something years later, I know
You
that
got
book.
it.
I sat in the hat with him. And then my daughter was actually a big fan of Fancy Nancy. I don't know if you have
I've recently heard about
Fancy. Fancy Nancy came out when she was little. So she's almost 17. So Fancy Nancy came out. And there was a book called Bonjour Butterfly. And, you know, and so we would read Bonjour Butterfly. And that was her favorite book. So I would have to say those two were my favorites then. And I don't know, like from a kid's book now, I mean, the Very Hungry Caterpillar was another one. The Very Hungry Caterpillar was hers when she was an itty bitty baby too. I like that one, and I still will buy that for people. Like if they have babies, I'll buy that for them.
I mean, what a great lesson on you eat through a leaf and you poop out all the junk you ate.
The rainbow, and then if you eat
belly feels better.
You feel bad. If you eat all that crap, you feel bad.
Did he mean? I wonder if he meant it like that, because that's the way I read it. Like, this is a lesson on GI health. Hot dog. This is amazing.
What to eat and what not to eat. What are your favorite books for your kids?
I mean, when they were little, like Pow Pow Fish and Little Blue Truck. Little Blue Truck is adorable.
Mm-hmm.
But now, even still, any Mo Willems book. So if it's Piggy and Gerald or the Pigeon books, Pigeon drives a bus, Pigeon finds a hot dog, like whatever. Those are hysterical. The Piggy and Gerald books. One of my favorites is Leonardo the Terrible Monster. Because he's a terrible monster, as in like he's a bad monster, like he's not very good at being a monster. Yeah, and I love that book. But I think my favorite book is a book called The Worst Princess, and I've talked about it before when we did the live with Senora Terry, who's the Spanish teacher at our school, but opened the most adorable bookstore. Oh my God, Kindle would love it. And we talked about it then, but it's about a princess who is waiting to be rescued from her castle, and the prince rescues her, and then the prince expects her to just like stay in the castle and not do anything, and she gets bored, and so she and the dragon become friends, and they start to wreak havoc on the land. And I love that book.
I
love that book. I think it's amazing.
That's fun.
Yeah. So, I mean, our library, we have a lot of books, but if they want a book, I can't say no to books. So.
Oh, I love books. Like first of all, I'm super sad because most of the bookstores around us, we only have like a couple. Most of them have closed. But like walking into a Barnes and Noble is like walking into heaven for me. Like I am just like,
yeah,
it's like this breath of like, oh my gosh, like to be surrounded by all these books. And I wish like I had more time to read, because I need to read more than I do, but I love books. I loved books when I was a kid, like Babysitter's Club series.
Oh, Babysitter's Club, Mary Ann.
Oh, and I mean, Are You There, God? It's Me, Margaret. Like I read that book so many times.
So I did start reading Roald Dahl books to the boys. So they love Fantastic Mr. Fox and the BFG, and those are amazing. But when Kendall comes back to look at LSU, I'm bringing you to Red Stick Reads, and you're gonna love it.
Okay.
You're gonna love it.
I can't wait, because I love bookstores.
Chelsea says, my child thinks that the library is better than most things.
It is. It really is better than most things.
It is. It really is.
Yeah.
Okay, my friend. Thank you so much for doing this. And we just talked up. I mean, like we talked so well.
We could
It's an
talk
hour and a
forever.
half. I was like, it'll be like 30 minutes. Hour and a half.
Plus an hour. That's okay. I like talking to you. It's great to see your face.
I like wisdom and wine. But
wisdom and
I
wine.
don't know if wisdom's the right word. Wine
Well,
and wine.
sure. There was some wisdom there, right?
Yeah. I mean, you're a stinking genius. Like you.
Not exactly.
Yeah.
I just tell it like it is. That is one thing I will do is I tell it like it is.
Which is so appreciated. Thank you. Yeah. Thank you so much for joining me. I'm gonna sign off for the live broadcast, so it'll end the broadcast, but then I can still talk to you for a little bit. All right, everybody. Thank y'all so much for watching. Lydia says this was fun. I would watch next time.
Definitely, Lydia.
Maybe we make it ideally we could do it a monthly thing, but in 4 years from now, we'll sit down and do it again.
Yes, because let me be real that Ashley's been working on me to do this for probably a couple of weeks, and then she sends me a text this morning and is like, "Hey, can you do it tonight?"
But it was I mean, with the ice here, and the boys were with my parents, and they were supposed to come back midweek, and then we couldn't get them back because all the roads were frozen because nobody in Louisiana is prepared for this, and so it was so last minute. I'm glad it worked. Thank you.
It worked.
All right, y'all. Have a good night. Bye.
Bye.